Hi, Olga. What brings you in today?
My wrinkles.
Your wrinkles. So show me which wrinkles bother you the most.
So this one and this one is the most.
Okay. Have you had Botox before? It looks to me like you've had at least a couple treatments before.
Oh, a long time ago.
Yes. And how I know this is when I'm looking at your face, I'm seeing that you've got a smoothness here and deeper wrinkles up there. So also as you're moving, I can see the strength of the muscles. So if you frown for me, please. If you look in your mirror, this muscle pull together. These muscles pull your eyebrows down as they get stronger, and they also make these lines, right? But I can tell from the way your muscle and the lines sit that you've had Botox here before.
Yeah.
And then a nice long break. In that time, your favorite expression, so you've noticed these are getting deeper.
Oh yeah.
Right, so basically what's happened is when we take away a movement that you're used to making, and say this is your favorite movement because you've got kids and you're all like frowning at them all the time, right? So if that's your favorite movement, the muscle gets stronger, and as the muscle gets stronger, the line gets deeper. But when we take away, after in your previous times of having Botox, when you've taken away that movement and you leave movement elsewhere, your face naturally wants to make expression. Now, if you can't do this, then you might do that. And by doing that, you make lines. And now because you've had a baby and because you've been nursing, you've had a long break away from Botox, you've managed to really strengthen this line. And you'll notice that this hasn't come back as bad as it used to be before. So in your circumstances, there's no way to have changed that. But normally what we say to patients is please come back regularly so we can maintain all the muscles so that we don't get this out of balance, extra deep lines. So a few things I want to cover today. How Botox works. Now we call them toxins, right? Neurotoxins, because there's so many different brands. There's Nuceiva, Xeomin, Dysport, Botox. So they all do the same thing. They relax the muscle. When you relax the muscle, then you can't make the line, right? So you can see it here in particular. So if you frown and look at yourself, when the muscles are stronger and stronger, you can see how that line will get deeper and deeper. Now, as you frown, notice that this becomes heavier. So if you did not do Botox, over time, you will go and look at your kids in your angry face and make this stronger and stronger. So then this eyebrow gets lower and lower. Another thing I'm noticing is you've got eyebrow asymmetry. So you can see that this eyebrow is just a little higher than that one, and the shape. And I know you draw them in, but you can just see from the muscle structure as well, it's different on both sides. So what I do that will be different from when you had Botox before is frown for me. I'll examine the muscle strength, and you'll find that the dosing changes each time I see you based on how the muscles are moving, which one's stronger, and how I want to balance the eyebrows back to both being the same height and the same shape. Your eyebrow shape is affected by the muscle strength. And if you frown, you can see clearly, frown for me, see how different this muscle is compared to that one, and how the lines are very different on each side of your face, of the middle of your brow, right? Yeah. So that's why you will not get the same dosing of, like most people when they do Botox, they'll come in and say to me, oh, so how many units are you going to do? And I say, I don't know yet. I have to look at your face, examine your muscles, and then decide what I'm going to put, how much I'm going to do it, and then I'll tell you. But they are used to getting the same amount of Botox every single time they go, but that's not how I do it here. The second most important thing is you told me at the start that the most important lines that bother you are the forehead.
Oh, yeah.
The forehead is the most tricky thing to treat. Why? It's because every muscle has strength and it has an action, right? So if you raise your forehead up, you're activating this muscle. Look what happens to your eyebrows. They go up, right? Raise up. And then as we showed you before, when you frown, your eyebrows come down and heavy. So where your eyebrow sits is a balance between how strong this muscle pull is versus how strong is this muscle pull. So right now I can tell you that your eyebrows are higher and your eyes are more open because you have such a strong forehead muscle. The
At least
problem,
something positive.
something positive, but you've got the lines to pay for it.
Yeah.
So when we treat the lines on the forehead, we have to be very, very careful, because if we really try too hard to take all the lines away and this muscle stays strong, it's going to pull down and your brow will feel heavier. This is how you get that side effect of a dropped brow from Botox. It's when we treat the forehead too aggressively and we're not thinking about how strong is the downward pull. So we talk about traction and counter traction. So which is stronger, the downward pull to pull the eyebrow down or the upward pull to pull the eyebrow up, right? And it's all to do with this muscle called your frontalis muscle. The one thing I want to show you is Botox by itself can never get rid of these lines. The best it's going to do is soften the muscle pull, and that's about all you're going to get. So this I want to show you very carefully and clearly, because your expectation is I'm going to get Botox and the lines are going to go away, because you got Botox here and the line can go away. But again, here you can see, because you've had, you know, the whole term of pregnancy, the whole nursing, baby is now what, a year and a bit old? So
1 year and 10.
Right.
Yes.
So now we're looking at almost 3 years since you've had Botox last. And you can see that now 3 years of making these lines, they're stuck in the skin. So to make your forehead smooth is going to take a combination of treatments. We're going to use Botox to stop the muscle from being as strong and pulling and making the lines deeper. But then we're going to talk about other treatments that will get rid of the lines. And I don't love filler for lines on the forehead. I think we have much better treatments to minimize the lines. For me, laser is the most powerful and the most effective. So we'll talk about that, because I noticed you have some patches in your skin here.
Yeah.
That's called melasma. And maybe it got worse through the pregnancy and that. So there's a laser we can use that will minimize the line and get rid of the melasma. So that will be better for you. And then we just use Botox to maintain that muscle to not get so strong that it makes the lines. So I don't ever overtreat the forehead. There's another thing that happens when you use Botox regularly. So you'll find a lot of places say you got to come back every 3 months, every 4 months or whatever, and they keep putting the same amount of Botox in you. What happens with that is we're weakening the muscle, but it's kind of like, you know, if you've got a nice big muscle and you're going to the gym, you build it stronger and stronger. So here you went to the gym, you made your forehead really strong and the line got deeper, right? But now if I put Botox and I relax the muscle, then the line relaxes. If I stop going to the gym, which is the Botox making the muscle not work now, the muscle gets weak and flat. So if you over treat the forehead with Botox very regularly, that's how people get that sort of shiny, flat look to their forehead. Okay, and nobody loves that look. I mean, there are some people who like it and they like those, like, you know, brows that go like that, which is fine. But for me, I want to keep you looking as natural as possible. So my goal for you is to train your forehead and your eyebrows on how to be through the strength and non-strength of one over the other. And then we treat your skin, and then we just use little amounts of Botox to maintain the result. So we're not going to use it to make the muscles weaker and weaker. We're going to use it to just retrain and then maintain. So we will get you to maybe even only once a year needing Botox to keep everything natural.
Okay.
So that's what we're going to do today. We're going to treat this. We're going to treat some of this, bring you back in 2 weeks to see how this responded. Based on how high and how even I've gotten your brows, I will touch up your forehead again. So I'm not going to treat the forehead completely today. I never do. The only time I will treat a forehead completely is if you lived out of town. So I get a lot of patients who travel in and I have no choice. They're not going to fly back in 2 weeks for a checkup. So then I just, you know, do it, but it's not my preference because I want to use the least amount of Botox for the best result. We don't always have to use a lot to get the best result. And then the other thing is, like I said, I'm really interested in making this brow and this brow more balanced. And that'll depend on how we assess and decide on the dosing for that. Now, one last thing, can you smile tight? Big smile, like big smile, like the sun's coming in. Okay, see that? So this is a circular muscle, orbicularis oculi. It also has a role in where the eyebrow sits. You can see how this fold, do that again, squeeze tight. See how this fold and squeeze tighter here? No, don't do that, just squeeze tight here, right? See how that eyelid fold goes straight there? So what that's showing us, lines run 90 degrees to the muscle fibers. So this is a circular muscle. This line is caused by that muscle contracting. But I want you to see that closing this muscle pulls into that as well. So relax. When we're trying to lift your brow and get you a nicer, more open eye, we should always treat orbicularis oculi as well. The other thing about the orbicularis is it is quite closely interconnected with this glabella muscle. And when we forget that there's another muscle and we stop treating too early, you get that little Botox line either going up that way, or you'll get an extra line coming out here. Those are from forgetting that there's another muscle to treat. So I usually will say to patients, depending on your budget, let's start with, we can do it all, or we can do an area at a time, but we must get to it all to get your face into its best balance. And on this side, we have to figure out what is pulling down more. So for an eyebrow to be lower without Botox in it, it's either this muscle here is too strong compared to the upward pull, or you're naturally too weak on the side. And you'll see it in some people where the lines are less on one side than the other. Then we know it's forehead weakness. That's not your case. Your case is you've got a way stronger muscle pulling down. So based on that, I will calculate for you, and then I'll give you a quote. Then we can decide which areas we're going to treat, or if you want to proceed to do it all, knowing that still in 2 weeks, you need to come back for follow-up. There's a couple reasons. I always use less than what would normally be recommended, because if your body will, if your muscles will respond to less, great job, right? We don't want to put too much because you can't take it out. We rather put less and then add more later. I guarantee you a result that is natural and even. If I give you an uneven result, I will correct that at no charge to you.
Okay.
But I'm using less, so if it's simply that you needed more, then there's a fee for that. However, if I cause something, I will fix it at no charge.
Okay.
So that's my guarantee to you.
I'm glad. At least I will have a nice look. So I hope to